حجا مبرورا وذنبا مغفورا وسعيا مشكورا لبيك الله.
Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Healthy Hajj, a program where we try to give some medical advice and tips for our brothers and sisters performing Hajj so that they would avoid having any medical issues and inshallah go back home safely and with forgiven deeds. With us today is Dr. May Meher, consultant of cardiology and also a consultant of aviation medicine. Dr. May, thank you very much for joining us today.
Dr. Ahmed, thank you for having me today.
All right, so since you're double qualified, let me talk about the aviation medicine, which is uncommonly practiced. And let me ask you, the patient or the person with a cardiac problem or hypertension on flight, what should they do and what should they avoid?
Okay, let's talk about hypertension. He is already on flight. So he should drink multiple of water regularly to avoid dehydration.
Yes.
At the risk of hypotension or thrombosis. But limit excess fluid if advised for heart failure.
Okay.
He can do also some seated leg exercises.
Mm-hmm.
And he should walk intermittently to prevent DVT, deep venous thrombosis.
Yes.
In some patients, we advise them to wear pressure stocking if they have varicose veins.
Okay.
He should also avoid excess caffeine as it exacerbates hypertension and leads to dehydration and arrhythmias.
Okay. So now that we arrived to Mecca or Medina first, please tell me what precautions should the cardiac or the hypertensive pilgrim do to avoid any further complications for their case?
For these people with the hypertensive or cardiac patients, they should consult their cardiologist
Yes.
at least 1 to 2 months before traveling to assess fitness for Hajj.
Okay.
Patients with unstable angina or recent myocardial infarction or decompensated heart failure or uncontrolled hypertension or arrhythmias
Yes.
should be advised to postpone performing Hajj this year.
Okay.
For those stable cardiac conditions like controlled hypertension or mild heart failure, they may proceed but require medication adjustment and probably pre-Hajj screening for blood pressure, or they might do ECG. And of course, they should review the medication with their doctor.
Of course.
They should minimize the use of diuretics to prevent dehydration during Hajj. They should ensure adequate supply of medications for at least 2 to 4 weeks extra to account for delays or lost prescriptions.
Yes, sure.
They should also carry like emergency medications like nitroglycerin for angina,
Yes.
blood pressure lowering drugs like the fast-acting angiotensin converting enzyme inhibitors.
Mm-hmm.
It's called the Capitan.
Yes.
And of course, we should have their aspirin with them.
Okay. Do you advise cases with cardiac problems or hypertension to perform the tawaf or the sa'i in Safa and Marwa on foot, or they should be in the cart or the golf car?
I think if they have problems, they should first avoid peak sun hours.
Yes.
It's from 10 to 4 p.m. If they can do that, they can use umbrellas and cooling towels or mist sprays.
Yes.
Of course, they can use wheelchairs if it's available.
Okay.
Of course, they should also recognize heat stroke symptoms like dizziness, nausea, confusion. And if this happens, they should seek shade and medical help immediately.
Okay. Do you have any advice more for the cardiac and hypertensive pilgrims?
Excuse me?
Do you have more advice for the for our pilgrims?
Yes, of course, they should avoid overexertion, like physical exertion.
Yes.
If they can do the tawaf and sa'i during cooler hours, like the early morning or late evening.
Yes.
Okay, and skip crowded rituals, like stone throwing. They can do it with proxy if high risk.
Okay. Dr. May Meher, consultant of cardiology and aviation medicine. Thank you very much for all these very informative advice. Brothers and sisters, hope that you, inshallah, would go back home safely. And until the next episode of Healthy Hajj, please do not forget to make dua for all of us here in Huda TV, and see you next episode, inshallah. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.
حجا مبرورا وذنبا مغفورا وسعيا مشكورا لبيك